Welcome back, everybody, to another edition of 5 Questions With, and it's a very special edition this week because I'm here at Adena Orthopedic and Spine Institute, where we're doing 5 questions with a doc, with Dr. Meaghan Tranovich of the orthopedic surgery part here at AOSI. Doc, welcome. Thanks for having us here today.
Thank you for having me.
So, like, when most people think of orthopedics, they think surgical, but there are a variety of non-surgical treatments that people can, for joint conditions, herniated discs, things like that. Tell us about those treatments and who are they meant to help the most?
Many, if not most of my patients benefit from non-surgical treatment first. So there are exceptions, of course. If you break one of the major bones in your body or you dislocate a joint, we don't always want to sit on those. But for many more long-standing conditions like arthritis or rotator cuff problems, it is beneficial to try things like physical therapy, anti-inflammatory medications like ibuprofen or naproxen. Joint injections can be helpful for certain conditions. For knee arthritis, there are gel injections, and there are topical medications, ointments and creams that you can rub on your joints. So there are a number of options short of surgery.
So I'm a 54-year-old guy, not quite 55 yet, but I spent about 30 years playing high-impact sports, baseball, softball, hockey, I think I mentioned to you before we started, basketball. So am I more likely to have a knee replacement? What are some factors that I should consider as I get a little older?
It's a great question. It's a difficult question to answer, to be honest with you. We don't understand everything about arthritis, but certainly we do know that if you've had an injury to the past in the knee, a major injury like an ACL tear or a meniscus tear, or if you've broken the tibia bone or the femur bone in a way that goes into the joint, you are more prone to develop arthritis and need a knee replacement down the road. But there are also genetic components, as I said, not completely understood. So not everybody is guaranteed to get arthritis, but you are more likely if you've had an injury.
So we were just talking about ACL injuries and things like that. So
yes.
Why are ACL injuries more common for athletes, and what are some preventative measures that maybe those athletes out there could take to maybe stave that off a little bit?
Right. Similar to arthritis, we don't always understand why people tear their ACLs. We do know women more commonly tear their ACLs than men. We know that there are certain sports that tend to be the culprits. Soccer and basketball are the 2 big ones, but honestly, I've seen patients tear their ACLs in every sport out there. So it's not completely understood again, but we do think there might be some preventative measures. So more commonly in high schools, there are ACL prevention programs in place, especially for our young female athletes. The main idea is having a well-rounded conditioning program where we're making sure that the hamstrings and the quadriceps muscles are evenly balanced and making sure that the athletes can sort of contact and pivot without undue pressure on the knee.
Most people also think of knee and shoulder replacements when they think of orthopedics. What are other common pain-related questions that you get as an orthopedic surgeon?
Orthopedics, there's a huge breadth to it. So there are joint replacements. We replace hips, knees, shoulders. We replace small joints in the hand and the ankle. We replace just about every joint now. But of course there are other conditions too. So hand surgery is a subspecialty of orthopedics. There's carpal tunnel, people with trigger fingers, that falls under orthopedic surgery. Spine surgery is part of orthopedics as well. What I do is sports medicine, so that's mainly shoulder and knee arthroscopy or scope procedures with a small camera. So that encompasses rotator cuff, labral tears in the shoulder, ACL tears in the knee, meniscus tears in the knee, and small cartilage lesions in our young patients in the knee as well.
What are some common injuries that you see maybe from industrial work?
In my clinic, probably the most common thing I see are overuse type injuries of the shoulder. So that can be anything from tendinitis, bursitis, which is like inflammation of the fluid-filled sacs in the shoulder, to rotator cuff tears.
So my bonus question today is, the Orthopedic and Spine Institute is almost a year old now. Mm-hmm. What does having a facility like this mean to our patients and for the region?
I think it means the world. I was so impressed the first time I came here with the facility, but even more important than that, we have such great doctors here and we have wonderful staff. So I think it's so important to the community to be able to get high-level care without leaving the region. It's wonderful for our patients that they don't have to drive an hour, 2 hours away to have their surgery and have their post-op appointments with their surgeon, and they can get it done closer to home and to their social support, which is really important in the post-operative period.
I think the thing that blows me away about it is, as beautiful and magnificent as the building looks from the outside, the equipment and the state-of-the-art things that we have inside are just fabulous. And it's such a great asset to have in a town like Chillicothe for sure. So,
Absolutely. I feel very fortunate to be here, truly.
Dr. Tranovich, thank you for taking a little bit of time to talk about AOSI today.
Of course.
And stay tuned for more 5 Questions With from the Chillicothe Chamber.